We're going to look at the male reproductive organs in this video. The principal structures of the male reproductive organs are the testes, the epididymis, vas deferens, ejaculatory duct, seminal vesicles, prostate gland, bulbourethral glands, and the penis. All of these are located in the pelvic cavity except for the penis and testicles, which are housed outside. So we're going to start with scrotum. The scrotum is a musculotendinous pouch that encloses the testes, the epididymis, and the lower portion of the spermatic cord. There are 3 layers of fascia that make up this connective tissue. It does surround the testicles, and it also divides the scrotum into the left and right compartments that does not allow for testicles to float freely between the scrotal sac. The testicles are a paired set of organs that are suspended in the scrotum. They do produce sperm and the male sex hormones. Each testis is composed of several hundreds of lobules that contain seminiferous tubules. These seminiferous tubules all converge into an area called the retete testes. We do see this area on ultrasound. It is an echogenic area that we see running right through the testicle. You can see those lobules make up this diagram, and they join in that yellow area, which is the retete testes. The retete testes then lead to the head of the epididymis. The head of the epididymis is seen on ultrasound exams as well. It is a tightly coiled tubular structure located at the superior posterior surface of the testicle. It does have a head, body, and a tail. The head lives at the superior pole of the testis. The body wraps along the posterior side of the testis, and the tail located on the inferior pole. The job of the epididymis is mostly to store sperm for maturation after it leaves the testicle. Here's a simple diagram of the epididymis. We have epididymal head, body, and tail as it wraps around. Again, you will see the head on every ultrasound image, and it is not uncommon to see body and tail, especially if the patient is experiencing epididymitis, which is inflammation of the epididymis. The vas deferens is a continuation of the tail of the epididymis. It is a muscular tube that ascends in the posterior portion of the spermatic cord. It does exit through the inguinal ring and then leaves the spermatic cord. It passes along the posterior wall to the posterior surface of the bladder, where it joins with the seminal vesicles. This is the junction of the ejaculatory duct that empties into the prostatic urethra. The seminal vesicles are paired accessory glands consisting of coiled tubules that form 2 pouches lateral to the vas deferens. The posterior and inferior surface of the bladder is next to this. It is superior to the prostate, and it does produce fructose and a coagulating enzyme for the seminal fluid. So this picture shows us those seminal vesicles. The seminal vesicles oftentimes look kind of like little lymph nodes or glandular type tissue. They're pretty easy to spot on an MRI and a CT because they kind of look feathery and fluffy, or almost like little bulges, and that's how they're usually drawn in diagrams as well. So again, these structures are basically our connecting point between prostate and male sex gonads. So then we have the prostate gland, which is the largest accessory gland of the male reproductive system. It does secrete a thin, slightly alkaline fluid that forms a portion of seminal fluid. It is located inferior to the bladder, surrounds the urethra, and is composed of glandular and fibular muscular tissue. The prostate is further divided into 4 main parts, but it is very important in actually creating semen. The prostate has a transitional zone, a central zone, peripheral zone, and anterior stromal. The transitional zone is a small glandular portion around the urethra. Around the base of the ejaculatory ducts is known as the central zone. The peripheral zone is the largest zone, and it extends from the base to the apex. And then that anterior stroma is basically a capsule that forms that anterior portion of the prostate gland. And the pictures over here basically show you those isolated areas. In a cross-section of a CT of a male pelvis, we are looking at prostate and rectum. Again, remember, we are not going to have Bladder typically at this level. I'm going to show you why. I'm going to go back to this picture. Okay, so here's prostate. Bladder's all the way up here. So if we're seeing prostate in a picture, it's most likely you're not going to see the bladder. If we're seeing bladder, we're not going to see prostate. So with males, we're going to basically see bladder and rectum or prostate and rectum. So I come back down here, I have rectum. Remember we said if there's probably black gas in it, it's rectum. The structure then is going to be prostate. I know that because I can see big gluteus maximus muscles here. I actually this is the cleffing that's basically a butt crack here that you're seeing in that picture. So that is the landmark that can kind of help you. As we look up here, we don't see any iliac bones as well. All right, back to the male reproductive system. We do have something known as the bulbal urethral gland. There are two of them. They're also known as Cowper's glands. They lie posterior and lateral to the membranous urethra. These secrete alkaline fluid into the semen. This actually is what helps the semen stay viable inside a female once it's ejaculated. So with the penis, we have external reproductive organs. It has two parts, the root and the body. The root is at the pubic arch, and the body of the penis remains free. There are 3 layers of erectile tissue, known as the corpus cavernosum and the corpus spongiosum. The corpus cavernosum is the upper surface, and the spongiosum is the lower surface that contains the urethra. I always like to think of the spongiosum, it's got to have a little bit of spongy or give to it because the urethra is going to change in size a little bit. So I did put a picture of a cross-section of penis here. Now keep in mind this is a coronal image of the body, but because penis does not lay flat with our body, this is a cross-section where we're seeing corpus spongiosum and then corpus cavernosum. And on ultrasound we can see those 3 parts. We have cavernosa, and spongiosum. And another picture of penis. This is axial view. So here's rectum, and we're seeing basically root of penis in this view. And we're also starting to see that here. All right, we're going to take a look at the male pelvis here. I'm going to scan up here, start in the abdomen and scan down. You will see bladder start to appear here. That large circle you're seeing right in the middle of your screen is going to be bladder. As I scan down, you'll start to see rectum appear. That's that black area right here's gas in the rectum that we're seeing. Between there, we're seeing seminal vesicles, which are your wing-like structures that we see appear between there. There's seminal vesicles again. As I continue to scan down, we're going to have prostate. Prostate is going to be this round walnut-shaped area that we're seeing right smack in the middle. As we scan down through pubic symphysis bone, which is this area here, we'll start to see root of penis show up right there. We get to that location as we scan down. Most pelvic scans stop when we get complete femurs, and we are basically seeing hips and buttocks as well as male genitalia.